A lot of people have questions after our first weekend with some restrictions lifted and people going back to work and into stores. Kristine Sorensen asks a local doctor some of your questions.
I'm Kristine Sorensen, around the table with Dr. Arvind Venkat, emergency physician at Allegheny Health Network, to answer your questions about coronavirus now that more restrictions are being lifted. And one question is, will gloves help keep me safe from getting coronavirus? Doctor.
I don't know that gloves are that effective because they can give you a false sense of security in terms of touching surfaces and then not touching your face or eyes or nose. What we really need to do is to be very systematic about washing our hands with soap and water for at least 20 seconds and consciously avoiding touching our faces.
Since we're heading into summer, can the virus be transmitted through sweat?
I'm not aware of any studies that talk about transmission via sweat. Everything seems to be from droplets related to coughing or sneezing or even speaking and the spit that all of us sometimes produce. That's not a mode of transmission that I'm aware of.
So, Dr. Venkat, if people feel like they need to see the doctor, but they've been holding off, or maybe they feel like they're having an emergency, like a heart attack, what should people do?
People in those circumstances should absolutely seek care. If you feel like you're having a heart attack or a stroke or other emergency, you should go to your nearest emergency department or call 911 to get the care you need. One of the great concerns we have in the emergency medicine community is that people are staying at home, but heart attacks and strokes and other emergency conditions still happen. And if people don't seek care, then the consequences can be quite severe.
And you can see more of Dr. Venkat's answers to our questions on CBSN Pittsburgh, streaming tonight at 7:30. I'm Kristine Sorensen, KDKA News.